Hi, this is Ed Tracy. We're here at Sutter Amador Hospital at the Diabetes Information Fair. So let's check it out. Tell us what we have here.
Well, I'm with Sanofi, and we have two insulins. One is a long-acting insulin called TSPN. The other one is an inhaled insulin called Afrezza. Both are new to the market, and they're going to be a great addition for any type 1 or type 2 diabetics.
Now tell me, what's the difference between type 1 and type 2?
Oh, type 1 diabetics don't have any insulin production at all in their body. Type 2 have insulin resistance built up over time by, eating too many carbohydrates or just a state of hyperglycemia over time leads to insulin resistance. So then they have to add on orals and at one point insulin.
And it affects any age?
It can affect any age, yes.
Are you nervous over there?
No, I'm having fun.
Fantastic. And so what's the difference between what you have here and whatever else is on the market right now?
Well, our product is based from a market leader, was Lantus, which is insulin glargine, and now TSPN is a brand new, also long-acting, more concentrated insulin glargine that lasts over 24 hours, which none of the other basal insulins do that. And then, of course, an inhaled insulin is totally unique to the market because there's no other inhaled insulin on the market.
Thank you very much.
Welcome.
How are you doing today?
I'm great. How are you?
I'm fantastic. You look fantastic.
Thank you very much.
And what are your names?
I'm Linda Matlich.
Alex Weiser.
And you are with?
You want it all? Commission on Aging, Area 12, Agency on Aging, and I'm your senior senator for the California Senior Legislature.
Well, hello, Madam Senator. Nice to see you.
Nice to see you. So periodically, everybody will get pieces of paper going. I really like if you guys would help me support this bill. We are having a senior rally on May 6th on the west steps of the Capitol from 9 to 3, particularly focused on issues involving our aging population.
Fantastic. And how long have you been a senator?
3 years. I was first appointed by Area 12 to fill someone else's position, and then 2 years ago I was reelected by my compadres there at Area 12.
Well, now knowing that you're a senator, you really look fantastic. Most people, they don't get any sleep.
Thank you. It's really interesting, the opportunity to help our community, the things that we can do to make life better for our aging population. The whole goal is to keep everybody at home.
Sure, absolutely. And that population, of course, is growing, and there's a lot more needs for that population as well, and this seems to get the word out.
It does. I represent Alpine, Amador, Calaveras, Mariposa, and Tuolumne counties. And in each of those counties, at least 33% of the population is over the age of 65. That's huge. That's really huge when you look at the demand on services in rural counties.
Sure, absolutely. And what do you do, Linda?
Well, I'm new on the commission, so this is a good chance for me to talk to Alex and learn more about it. I go to the meetings, but this is even a more in-depth learning process for me, so I volunteered to come along and learn a little bit more.
Awesome. So we see things here like volunteer opportunities in Amador County. What kind of volunteers are you looking for?
We need a couple of people on the Commission on Aging. There are a lot of groups like our hospice and the hospital here and the food bank, animal control. There are a lot of opportunities in Amador County, and that booklet is stuff that our Commission on Aging has compiled over the years of volunteer opportunities here in our county. This is one of our great programs that we're doing this year, and these are reflective signs. For $20, we put these together and we give you everything you need to put it on your property, and we're really being backed by the ambulance service on this. Sure. Because there are so many rural homes in our county that, that call for an ambulance or...
Hard to find.
Hard to find. Impossible to find. And this is really an opportunity. We hope to get more of this out into the community. Awesome. So, helping the seniors in our community is a great plan.
Absolutely. Thank you, Senator.
Thank you.
It's the Hamptons, everybody. Sharon and Marv. What do we have here?
We are Get Healthy Amador. And it's a program that you sign up for, and it's put on by the hospital, and it's put on by New York Fitness and Amador Public Health. And you get a packet when you sign up on the computer, and the packet has it tells you it gives you a video instructions, it gives you a stopwatch, a T-shirt like that, and resistance bands and more. And then you get a personal guide to help you through the exercise program. Every week you can get online, and it tells you where you should meet. You know, you have a captain, etc. It tells you where you should meet for your exercise program. And it goes for like a 6-month program, so it'll probably go through maybe October. And it says it's 6-month program, $35 per person or $65 per family. Is that any age? Any age. It's for children on up.
The hospital and the rancheria have joined together where they're subsidizing $25 of that $35 for their employees to join.
Yes.
That's a good deal.
Very good deal. And it's real personal. So we're going to help you through the whole process. They did this before in Nevada City, and they've done it in Oklahoma City, and the whole towns, or the whole cities have gotten healthy and lost weight and kept it off.
And you and I are kind of, well, you run a lot. I know you run a lot. Sharon, how many miles do you run a day?
Well, now I probably run 5 a day, but then I run, on the weekends I run long, really long. And now I'm trail running too, along with running on the road.
This woman runs a lot.
Yeah, but it keeps me healthy.
It does, absolutely.
Keeps me healthy.
And this is perfect for you, because if anybody stays healthy, it's Sharon Hampton. Thank you very much.
Thank you very much.
All right, ladies, what do we have here? Who are you with, and what do we have?
Well, this is United Home Care and United Personal Care Services. We have a private pay side. This is your private caregivers that come into the home for light housekeeping, respite care. And over here on my left-hand side, we have our, this is our skilled side. So we have nursing, physical therapy, occupational therapy, speech therapy, and social work. So a lot of times patients will come into the hospital and be discharged home, and we will go into their home and provide services to them.
Now, is this covered by insurance? Do they pay out of pocket? How is this covered?
So since there's 2 sides to our company, this on my right hand side, the personal care is a private pay. There's a few insurance companies we take, but it's mostly private pay. The United Home Care side is we take Medicare, commercial payments. So.
Cool. I see you have a lot of candy here. Is this all sugar-free?
Yes, thank you. Help yourself.
Sugar-free, everybody. Foothill Fitness. What do we got here? Tell us about what you got.
Foothill Fitness is a program designed for seniors 50 years and older. It's a volunteer program through the Senior Center. We have various sites. We have sites in Plymouth, Jackson, Pine Grove, Pioneer, Sutter Creek, Volcano, and Ione. It was established in 2004, and it's the trainers are all volunteers, and we focus on balance, flexibility, strengthening, coordination, a little bit of cardio, and it's to help seniors who lose a spouse be able to remain independent in their homes.
Awesome. I heard you explaining these bands. Tell me about these.
The bands are for strengthening. We have 2-pound, they're equal to 2-pound weights. The blue bands are equal to 5-pound weights. The black bands are equal to weights. We also have silver bands that are 9-pound weights, and gold bands, which are 14.5-pound weights.
Wow.
I'm a volunteer trainer. My name's Laura. This is my husband, Skip.
Hi, Skip.
Howdy, how are you?
And we've been doing this since 2008. I started out with a 2-pound strengthening band, and I now do the 14.5. We do it 3 times a week in Ione, Monday, Wednesday, and Thursday, 1-hour classes.
Now, where in Volcano do they do this? At the Armory Hall?
In Volcano, they do it at the Volcano Armory, yes, at 10 Consolation Street.
I know exactly where it is. I live right across the street from it, so yeah. And what does it cost to do this?
$1 donation if you can afford it. If you can't afford it, you're still welcome, and you don't have to pay anything.
$1. How could you beat that? $1, everybody, just to stay in shape. Foothill Fitness. It says Foothill Fitness, good to go.
There you go.
Awesome. Thank you very much.
You're welcome.
We are here with Sutter Health Weight Management Institute. Is that correct?
That is correct. Actually, patient education has Sutter weight management, we have diabetes education, and we have nutrition education. So we got 3 tables.
Now, I asked somebody outside, since you're at the hospital, maybe you can elaborate. What's the difference between type 1 and type 2?
Type 1 diabetes is when your pancreas totally shuts down making insulin, so they always have to take insulin. Type 2 usually is a little slower increase. We usually get it when we're a little older. You still might make some insulin, so you might be able to control it with diet and exercise or oral medications or possibly insulin.
And what are some of the telltale signs of each?
For both, the signs of diabetes are similar. So you've got increased thirst because you've got all this sugar in your system. Your body's trying to get rid of it. So we have increased urination. That makes you more thirsty. And then increased hunger because when you're basically eliminating all your sugar out your kidneys, you get hungry. You're not getting all the food you need.
Sure. And these are examples of what?
A good meal planning. So we think of our plate, we fill half of it with veggies. And then we have a quarter of our plate is our protein food. So this would be like a chicken breast. And then a quarter of your plate would be your starchy things. So it could be bread, it could be rice, it could be noodles. Then maybe throw a little fruit in there too.
Yeah, I like it.
Now, in our weight program, we offer 3 tiers. So we have a class that we offer locally. The next one will be in July called SOS, Sutter Options for Success. It's a 12-week behavior change program. And then tier 2 is more of meal supplements. SOS is done with real food in your real life. Supplements might help people so then they don't have to think about food too much. And then 3rd level is weight loss surgery.
Oh, okay. Awesome. And when does this start?
The next one will be in July.
Okay. And is it a weekly thing? How long does it last?
It's once a week for 12 weeks. Ann here teaches it.
Hi, Ann. Let's go talk to Ann, everybody.
Yay! I thought I was going to get out of it.
You are not getting off the hook.
Oh, man. Again.
So what do we have over here?
Okay, this is mostly the nutrition display. So sometimes people can actually come in and for nutrition issues. Maybe it doesn't have anything to do with diabetes. Maybe it's something else, and I might be working with them on that. What you see here, though, are appropriate portion sizes for food. We have the class flyer so that you can call that number and sign up for any of these classes that you'd like to attend. We have a display showing how much fats and appetizers. So you want to see something? I can show you something, Grace. Let's see. This is fat and onion rings.
Oh boy.
Mm-hmm.
Oh boy.
Yummy, yummy. Or my favorite.
Dang.
This is how much sugar in a 12-ounce soda.
Oh my gosh.
Oh, that's not so bad.
No, what? I'd rather have a chocolate chip cookie.
That's one chocolate chip cookie?
That's a chocolate chip cookie. That's sugar.
So-
in the soda.
So do you have a vial for the bag of chocolate chip cookies that I ate the other night all by myself?
Get a bag and put a bunch of those.
I'm joking. I'm joking. All right.
All right.
And where are you from? Where's that accent from?
I'm from North Carolina.
North Carolina.
It'd weird you out if I said Sacramento, wouldn't it?
What's that?
Wouldn't that weird you out if I said Sacramento?
I would have been a little concerned.
Australia. Well, I lived in Australia for 3 years.
That's
I
not-
can do that.
That is not what I'm hearing. Thank you very much.
No worries.
We are Mini Pharmacy, which is California's #1 mail order pharmacy, and we're here to service all the folks. Sutter is like our family. We've been working with them for a number of years.
And
I'm here in Amador.
you're all online?
We are online, but we are a mail order pharmacy.
Gotcha.
Which you know, to help the service of the folks. We put kits in there in hospitals and facilities, and kids that come in and diagnosed with diabetes at least can go away with a smile and a kit provided by us.
And so the patient gets their prescription. What do? Do they call you? Do they fax in their prescription? How does it work?
We work right through the facilities, and they're set up prescriptions through us through our facility, signed by the pre-signed by the doctors. Mm-hmm.
What's your name?
Sharon.
Sharon, where are you from?
Pioneer.
Pioneer. And you're here for the information fair?
Yes,
What's your name, sir?
Roy.
Roy, how we doing?
We're doing fine.
Great. So I'm guessing if you're married to her, you're from the same town.
Right.
All right, just checking, you know. And what do you hope to find out today by being here?
Well, they're not here to help me.
Well, who's not?
My Freestyle. I can't find them for my meter.
Gotcha. So do you have type 1 or type 2?
Type 2.
And what do you do to control it or help alleviate it?
I'm on the pills. So, but I've been able to do that pretty good.
Good man.
Yeah, and they're very helpful here.
Good. How long you been married?
Do you really want to know?
Yes.
What is it, 50 years?
All right. Don't look at her. When's your anniversary? Don't tell him now. When's your anniversary?
I do not know that.
Oh, brother. Doghouse. You're going to need more than pills, my friend.
I'm not good with.
Oh, boy. Well, thanks for talking. Ladies, what do we have here?
Amador Lifeline, where help is just a button away. Community program for over 33 years. Locally staffed and full of volunteers to meet every need that is needed.
And Pat, you're a volunteer and you're also a client, is that correct?
Yes, I am. A very grateful client.
Have you ever had to use the Lifeline?
Many times.
And is it a pretty quick response time, would you say?
Yes, it's very quick. In fact, every now and then the button rings. They call me when I have done something inadvertent. It happened. But what I really love is that my husband was a great user of this too. When I would take my husband down to the hospital, which I would do frequently, and now people can take me, you get down there and you go in and you sign in at the little desk and you sit and you sit and you sit until all these people are taken care of. And I like to think they're being taken in the proper order, but you never know. I can't. But if you go down with Lifeline, you go in an ambulance, they take you in and you're put in a room immediately. And they have wonderful help there. They take good care of you. And what I like about Lifeline mostly, I think, is the people they have working there.
Virginia's kind of cute.
Oh, I've known Virginia. She's my second daughter, and which is why I'm working there. You know, I was doing a lot of volunteers at other places, and finally I said, my God, I love Virginia more than anybody else. Why am I not down there?
We all love Virginia.
I know.
Well, the nice thing about Lifeline, again, like Pat is speaking, is we are local. We're not an 800 number that you see on the major news, and then they mail it out in a box. And then if you lose your button, you've got to wait a couple days to get another one. Or if you fall and you don't get help, you know, there's nobody to talk to. And so with this local program, we send somebody out, they install it, they walk your property to show you the range. We have so many different buttons now. As I say, we have the automatic fall detection button. We have our standard button you can wear on your wrist or around your neck, and a new wireless unit. So if you don't have a landline, you can actually still have Lifeline. We do prefer the landline because if there is a power outage, your Lifeline continues to work through that telephone line. In the wireless, you still have a battery backup on your phone for up to 48 hours, but the landline's still preference. And now we have new GoSafe, which is a portable system. Not so hot up here because signals when you get up country aren't as good. But we're staffed for every concern. It's fire, medical, and police. They even talk to people who are very depressed, and it can get depressing when you live up here on your own. Sure. We have a lot of seniors now where one of the people are out working or are very involved socially, and the other member is at home and they're concerned, you know, for their safety. The button's waterproof, so they wear it in the shower or out in the pond. Now, we're very, very proud of our product. Say we've been here almost 34 years now. No contracts. We're not for profit. We're here for the community. Now, safe in their homes.
You said it's local, so is there a dispatch? When somebody pushes this button, where does it go?
It goes to a call center, and then they determine in talking to you, do you need someone to, an ambulance to come, or do you need someone to come and help you? Or do you just need like the fire to come and help you get up? Because we are volunteer fire, and that is who goes out and assists people if they don't have a neighbor or a friend or a relative close by that can do it. So it isn't always an ambulance call. We do have responders, which are people that live close to the client. And the reason we use that is sometimes for services, as we know, if you're way up in Pioneer and the dispatch is, the ambulance is down in Pine Grove, it can be a matter of minutes. They still call a responder who goes in and sits with you until help arrives. And we've had a woman where she, in fact, fell. Her responder came. She said, I just need help getting up. The responder came in, said, no, she's bleeding from the ear. The woman did not realize that. That rerouted the whole call now to an ambulance call instead of volunteer fire to come and assist. So that's the beauty of the program. We are now endorsed by American Legion Ambulance. They see such value in the fact that we work together all the time. And as Pat said, you push your button, you get right into the hospital, and that's very important. Timing is critical to whether someone's going to remain in their own home or they're going to have to receive greater level of care. And we know that 1 in 3 is going to fall over the age of 65 this year, and over 70, half that population falls, with half of them falling again within that year. Statistically, falls are the greatest cause of death for seniors now, over any other disease. And of course, we're here at the Diabetic Health Fair, and we know that if you're diabetic, you're at a greater risk for fall. You just have more contributing factors. And so we're here to instruct people and to let them know we're here. If you are on our program and you lose your button or your dog chews it up, and that has happened, we're out within 2 hours to give you a new button. And we have clients that lose them, and we give them a couple months to find their button before, they're charged for a new one. If there's a problem with your unit, then we're right out there. Sometimes you have a grandson that came and unplugged the unit to put in his device to charge it, his laptop or his iPod. And now they've got blinking lights and they can't reach down to plug it back in. So we send somebody out and we get it all plugged back in. So there's such a benefit to being a community member in that respect.
Very cool. Thank you, Virginia.
I might add that not only are we do we have a fee, but we also have an income restricted program for those that really do have some limitation with their incomes. And now in Calaveras County, where we also are, we have the income restricted program there also, and that's funded through the Community Foundation. So no one should not have Lifeline.
Sure. Awesome. That's an awesome program, and I think it's well received. I think there's a lot of people that could certainly use it.
Right, and we thank our community partner, which is Sutter Amador Hospital, for having the health fair, but also they buy us new units. And so their board, their foundation board, and Platt, see such value in this as an assistance to the people that are leaving the hospital. So we thank them too for their community involvement.
Thank you so much.
Thank you.
Ladies, how are we doing? What is your name?
My name is Mamie Kenworthy.
And where are you from?
From San Andreas.
Fantastic. I got that part. Thank you so much. And your name?
Kathleen.
And where are you from, Kathleen?
San Andreas.
Do you two know each other?
Yes, she's my caregiver.
Oh, well, you're lucky. You're lucky. Does she cook for you?
No.
Can you cook?
No.
Oh. Because I'm looking for somebody to cook for. Oh, really? Are you a good cook? What kind of food do you make?
Anything you want me to make, I can make it.
Are you hitting on me right now?
Yeah, I am.
Atta girl. That is fantastic. So what brings you here today?
I have an appointment today here. I have a CT scan. CT scan.
Yeah. And can I ask you a personal question? Do you have diabetes?
No, she does.
I do.
And how do you control it?
Very carefully. Very carefully. I'm pretty good. I'm pretty good with it.
Good.
Sometimes I get out of the way. Like if I want some ice cream, I'm going to eat some ice cream, but only occasionally.
So let me, because I don't know how all this works. If you have something you're not supposed to have, what happens?
Sugar goes up, yeah.
And then what do you do to fix that?
You eat better. You eat better foods. Better, like, just good food, man. I don't know what to say.
Good. All right. Is she telling the truth over here?
She's telling the truth.
So pretty much you're her caregiver sometimes too.
Sometimes too, yeah. But she does a good job with me. She helps me with the house and stuff. Yeah, and takes me with appointments and stuff I have to go to.
Good.
Because I had cancer.
Well, you look fantastic.
I don't have it now, but I had it. That's what I'm here for them to see if it's in my body anymore.
Sending good energy your way, young lady.
Yeah, I sure am. I'm taking care of myself.
You bet. Well, you look great.
Well, thank you very much.
Attitude is everything.
Yeah, this is. You got to be strong. You really do. It's a hard thing to go through, but I went through it for 6 years now. And it's still around, still kicking.
You're stubborn, I got a feeling.
Very stubborn.
I bet you're fun at parties.
Oh, I was years ago.
Thank you, ladies. Thank you so much. All right. Everybody, this is Craig. Hi, Craig.
Hi. How are you doing, Ed?
I'm doing fantastic, sir. So tell us about your organization here.
We're Quality In-Home Care. We've been in the county for about 9 years. We've been together as a company for 24 years. We're family owned and operated, and we have quite a few clients over here in Amador and also Calaveras County.
So now, are these patients that typically are coming out of the hospital and they need continued care, or does the care start in the home, they never go to the hospital?
It's a little of both. There's a little bit of respite. There's a little bit of outpatient services. We do anything from housekeeping to transportation. If you need to be taken to the doctor, we can arrange that. We can arrange bath visits, a little bit of everything.
Cool. And are you primarily Amador County, or where do you go?
We are all over Sacramento County, Placer County, El Dorado County, Amador, Calaveras. We're in about 7 different counties, and we try to stay pretty busy.
Good. And it's a company that's needed. A lot of people these days, they're getting older, they got health issues.
Yes, it is. I've been in the business now for about 30 years, and I enjoy every bit of it, and every day's new. It's just like having a dementia. You learn something every day.
Yeah, you're a busy boy because we hang out occasionally,
yes,
and your phone goes off like crazy,
yes,
doesn't it?
My phone does go off like crazy. I am constantly working. In fact, I have my 2 phones with me now, and I'm surprised it hasn't rang. But other than that, life is good.
It won't ring because you're doing something you don't want to, and that's talking on television.
I know, and I'm always on television because this is anyhow. You in Amador County have a wonderful day.
You too, buddy. Thank you so much.
Thank you.
How are we doing? What's your name?
Oh, my name is Christian, and I'm from public health. Well, here at the Diabetes Health Fair, we want to help people with diabetes understand that tobacco smoke is a big risk factor for many secondary conditions that can happen, such as retinopathy, heart and kidney disease, many others. So, yeah, we have information on that, cessation materials to help people quit smoking, and we also have our tobacco-free parks kind of stuff here. And this is some litter we found at Dietert Park and at Howard Park, if you notice.
In one day?
Yes, Dietert Park, we found this in about an hour and a half of cleaning it up, and that's just at the playground at Dietert Park.
Wow.
Yes.
So smoking affects diabetes?
It does. It can help elevate blood sugar levels, and they think it's the nicotine. It's known that people who do smoke are more likely to get many of the conditions which are very deteriorating.
And tell me, what is retinopathy? I have no idea.
I don't remember what that is, but it was on CDC. If you hold on a second. It's an eye disease that can cause blindness.
Gotcha.
Yeah, and I don't have it, so. And diabetes is not my specialty. The tobacco reduction program is, so. And yeah, this is new to me. I'm learning a lot about diabetes.
Yeah, for sure. There's so many factors that play into diabetes. Type 1, type 2. Type 2, it seems like, is a little bit more treatable than type 1, I would think.
Well, you know, type 1 is what we often think of when people are kind of born with it, and it just develops as a child. And type 2, it's mostly older adults that get it as a result of being overweight. So, yeah.
Thank you very much.
Yeah, thank you. Appreciate it.
How are we doing? How's everything?
Hi, how are you?
Good. What's your name?
My name's Gary.
Gary, where are you from?
I'm from actually Tracy.
Tracy. And what do we have here? What are you displaying?
I represent Insulet Corporation. We make the world's only tubeless insulin pump. So this is a patch pump. So basically, it's for type 1 diabetics. It's indicated for that, for patients that are using insulin therapy to manage their diabetes. So it's a more simple way of delivering, continuously infusing insulin into a patient who's using insulin therapy. And it's different than most traditional pump therapies.
Gotcha. So I have a gal that works for me. Her son's got type 1 diabetes. He's got pump that goes in, right?
Right. So the difference with ours is that ours does everything automated. So if you think about, you have a wireless controller with an integrated blood glucose meter, and the basic design is to simplify the footprint within your type 1 diabetes space. So the difference with this pump is you have an integrated blood glucose meter right here. So you put the strips here, you check your blood sugar, and then basically it becomes married with this pod, which is your pump.
So it automatically adjusts and all that?
Yes, so you can program it and put in different numbers every hour, because some people wake up with higher numbers in the morning. So the great thing is you can customize this based on what the patient's experiencing, and it will help simplify their diabetes management.
Gotcha. So this basically tapes to your side, is that right? Or
basically anywhere you give yourself a shot, if you want to look there, you can put it anywhere, on your arm, on the back of your hips, on the outer part of your leg. If you notice, every patient in most of our promotionals wearing it in a very unique place where you would not normally give a lot of injections. On the thigh, on the arm, on the back of the hips there, that surfer, he's a surfer, real surfer from Southern California. This is one of our kids who lives out in the middle of the country, and he's a Little League player. And this is a lady down in San Diego who surfs. They're actual patients who wear it because, diabetes is pretty imperfect. It goes up and down and it fluctuates. And what our design and our mission of our company is just to make managing your diabetes a little bit easier.
So this must have some pretty good adhesive on it, I would guess.
Yeah, it uses like everything that you would normally use on your infusion sets, on a lot of the stuff that they use medically to get a really good stick on there. You can use like baby oil to remove it after you wear it, but you would generally wear that pod for 3 days, and then it would continuously infuse, and then you would do a blood sugar check every time you're going to eat a snack or a meal, and work around that as well.
And insurance cover any of this stuff?
Private insurance covers it right now. One of the things we're working on is obviously Medicare, and that's going to be an ongoing process, but we can't really talk to that right now. But private insurance, we can get pretty good coverage for all the patients.
Gary, thanks a lot, buddy.
You're welcome.
All right, how you doing? What's your name, sir?
My name is Greg.
It says it right there. What a coincidence. And you are And you are with
NovoNordisk.
And what do you do?
So NovoNordisk is a diabetes company that manufactures insulins, other medications to treat diabetes.
Type 1?
Both type 1 and type 2. So insulin would be a requirement for both types of diabetes, right? All of this right here is all non-branded educational information. So it's great to make the medications, but if a patient doesn't understand how to take it, and they don't understand the other facets of managing their disease, then they're probably not going to be compliant over the long term with the things that their physician has asked them to do. And thus, all of the educational materials that we provide to physicians and the educators to help patients understand the disease and help them manage the disease effectively.
So, and I see here, and I never really thought of this, but diabetes and depression, is that a big thing?
Absolutely. I mean, think of it. You've just been told by your physician that you have diabetes, that now you have to start checking your blood sugar maybe 4 or 5 times a day. Maybe you have to start taking insulin medications, right? So very complicated, at least initially, to administer those things and making sure that you're eating the right things. So yes, it can be very overwhelming for a newly diagnosed patient.
And I think the big question that I hear a lot, do you think they're ever going to find a cure for any of this?
Well, it's actually our company's mission statement, to defeat diabetes. Our business is to go out of business. So there are some very exciting things happening in terms of research and development. It's actually a very exciting time because there are a lot of great new medications out there, and there are a lot of very exciting things on the horizon that may get us to a place of defeating diabetes in 20 or 25 years.
Fantastic. Gary, thank you very much.
You're very welcome.
This is Annie, everybody. Annie, say hi.
Hello.
And do you work at the hospital?
I do.
What do you do?
I am a diet tech here at the hospital.
And she's at CrossFit with me at Rugged Edge. She is amazing.
Well, thank you very much. So are you.
So what do we have here?
So this is our annual diabetes fair that we have once a year. And right here at the table, I'm just kind of giving everyone their baggie and their pill boxes. I'm handing out information about our free diabetes support group that meets once a month here at the hospital. It's facilitated by a registered dietitian, and it's fabulous. So, yeah, and we also have a free raffle.
What are we giving away? Trips to Maui? What are we doing?
Better, actually. We have it's a SOS weight loss series program. It's a 12-week program. It's facilitated by a dietitian. It's here at the hospital. So,
very cool. Yeah. Are you getting enough to eat there?
Always.
What is your name, sir?
Richard Jones.
And where are you from?
Pine Grove.
And you're here for the diabetes fair?
Yes.
Do you have diabetes?
For 17 years.
And what do you do to help control it?
Eat properly and exercise.
Good man. And take medicine. Do you know this lady?
No. We're married 59 years.
Well, nobody likes a quitter, Richard.
Damn right, and we're working at it. We're just starting. We're starting over.
Still on the honeymoon?
We're trying to be.
What's the secret to 59 years of marriage?
I don't know. Just keep right on going as best you can.
I think you have to respect each other and listen. You learn.
And a lot of yes dears?
Oh, always. That started day one. I mean, that hasn't quit.
And how many kids do we have?
4.
4.
And 10 grandchildren and 11 great-grandchildren.
Wow.
Yeah.
That's a big family.
It is, indeed, yeah.
Get to see them a lot?
Most of them, yeah.
Good.
One of them's in Texas, but he'll be home for a vacation in June, so we'll get to see him and the kids, so.
That's awesome.
The other one's in Tennessee.
Tennessee? Boy, they're all over the place.
Well,
they go where their work is, so that's what you have to do. I came from Pennsylvania back in '60, so.
I'm from New York.
I won't hold that against you.
Thank you so much.
Used to do a lot of drinking over there.
I can't say.
I'll see 18 when I was growing up, and you could drink then, so.
Yeah, there was prohibition when I was a kid.
Really?
Yeah, it was my grandmother. She said I couldn't drink.
Oh, well, we got it out of the bathtub.
I don't know how to respond to that, Richard. I don't.
Try not. This just works out good, but.
Well, thank you, folks. Have a great day.
Great.
Dodie?
Dodie.
Dodie Steinfeldt.
Because I'm bigger than a dot.
Boy, I'll say. Where are you from, Dodie?
Where originally?
Sure.
Colorado.
Colorado. What brought you out here? Don't say a man.
The weather. Yeah, my husband did.
How long you been married?
62 years.
You're not
Tomorrow.
old. Tomorrow.
Mm-hmm.
What are you doing for your anniversary?
Nothing.
How's that working out for you?
Wonderful.
What? What do you do here at the hospital?
I am I go around and take inventory of refrigerators in different units, and I also go upstairs and pick up menus from the patients.
How long you worked here?
That's a good question. I think about 10 years.
Good for you.
Or better, maybe.
Man. Very rewarding, is it? You enjoy what you do? I'm going to go with no. I hate it. Want to do something else? What do you want to do? What do you want to do when you grow up, Dodie?
I don't know. I can't remember.
You're the best. I'm coming back here just to see you every day.
Oh, I'm only here on Thursday mornings.
Okay, well, I'm not coming back then. But I'll be looking for you on Thursdays.
Okay.
All right.
Good luck.
Thank you. Where's my lunch?
I don't know.
I thought we were friends.
I can go get you one.
No, I'm on a diet, but thank you. What's your name?
I'm Sarah.
Sarah, you work here at the hospital?
Yep.
In the dietary program?
Yes, I do.
And how long you worked here?
I've worked here since November.
Do you like it?
Oh yeah, I love it here. It's a great place to work.
And I see you bringing everybody food. What are you bringing them?
I'm bringing them turkey sandwiches and veggie sandwiches. And then there's veggie trays over there and muffins.
Can I get a gin and tonic?
Sure. No.
Thank you so much. Thank you. Oh, that's at another hospital.
Yeah, that's another place.
All right. Hi, ladies. How are we doing today?
Great. Great.
Gina Deutsch?
Gina Deitch.
Deitch. German?
Yes.
Yes. And Liz Peterson?
Yes.
And you ladies are with Area 12?
Yes, we are.
And what is a HICAP?
HICAP is Health Insurance Counseling and Advocacy Program. We assist Medicare beneficiaries.
So what do we have here, ladies? Tell me a little bit about what you got.
We have all our brochures from our agency. We assist seniors 60 and over.
It's a jar opener. Or you can play Frisbee and get kicked out of the hospital.
Exactly. With the high cap program, we assist Medicare beneficiaries. It's a good idea to review your Medicare plan every year. A lot of people are new to Medicare or getting ready to retire, and we can help them navigate the Medicare maze.
Area 12, is that a nonprofit?
Yes.
And how are you funded?
Through part of the Older Americans Act, so it's federal down to state.
And it's a county organization?
No.
They're actually national, so there's 675 agencies on aging that cover every county in the state or in the United States. And there's like 33 in California, so Area 12 encompasses the 5 counties that we serve.
Which are? Quiz.
Amador, Alpine, Calaveras, Tuolumne, and Mariposa.
You are hired.
Yeah.
And so you ladies cover all that.
Yeah, so we assist seniors, connect them to any kind of resource or program that's available to help meet their needs, keep them safe and independent in their homes.
Oh, look, is that you right there?
It is.
Well, look at that long hair. When did you cut your hair off? Not that it looks fabulous, by the way.
Last summer.
Wow. So HiCap and the Agency on Aging.
HiCap is a program within our agency.
Gotcha.
Yeah.
And what kind of, there's just a whole bunch of stuff here. There's volunteer opportunities through, right? And different programs.
So like Meals on Wheels, we help fund the Meals on Wheels program, and there's transportation assistance and legal help and in-home care and case management and all kinds of really anything that seniors might be in need of if they need help with getting adaptive equipment in their home, like a walker or anything like that. Yeah.
So you have all these things that help seniors. What's the one thing that you'd like to see Area 12 be able to do? What do you need?
Well, I think the biggest need that seniors have in our areas that we serve is transportation assistance. Because we serve rural counties, it's very hard for seniors to get to where they need to go or where they want to go. And the transit system can be difficult, although Amador County Transit works really well with seniors, and they try to serve seniors really well, and they do, but still, for some of the remote towns in Amador County, it's tough.
Do you have a lot of volunteers that drive people around and stuff?
We don't. The Common Ground Senior Services, they have a transportation program that we help fund, yeah, and they do that.
Very cool. Thank you, ladies.
Yeah, sure, thanks.
Excuse me. Hi there. How are you?
Fine.
What is your name, young lady?
B. Hendricks.
And where are you from?
Sutter Creek.
And are you here for the information fair?
Well, I came with a couple of ladies. Check it out.
And are you finding everything okay?
So far.
Did you get something to eat?
Oh, not yet.
You want me to get you something to eat?
No, thank you.
So what do you hope to find here?
I really don't know. I know a lot of information.
Do you have diabetes?
No, I don't.
Well, lucky you.
Yeah.
Do you know anybody with diabetes?
No, not offhand.
And where's all your friends?
Two ladies there on the table.
I should harass them. What do you think?
You should ask them, yeah.
I should totally get after them.
I know they're more interested in it.
As soon as they come over here, I'm going to get them. Don't you worry. Hey, I've been waiting for you.
No, you haven't.
She said to come talk to you.
Oh, yeah. Hi.
What is your name, young lady?
Darlene.
Darlene, where are you from?
Sutter Creek.
And you're here for the Diabetes Information Fair?
Yes, sir.
Do you have diabetes?
No, I'm kind of borderline. I just got to watch what I do.
Sure. Good eating, stuff like that?
Yep.
Stay away from the whiskey?
Yeah, they won't let me have one anymore.
You and me both, sunshine. So I saw you looking at the Amador Lifeline over there.
Yeah, that's a good deal. That's neat.
It's a good program.
Yes, it is. Very good.
Especially if you live alone and you need help. Yep. Can certainly be a benefit to you, right?
Yep, sure would.
So while you were gone, we had to keep this one out of trouble. She is nothing but trouble. Look at her.
This is the first time she's been here, so we brought her. She brought us today, so.
Who's driving? It's like Thelma and Louise.
Yeah.
Well, thanks for coming out today, ladies. Thank you so much.
Thank you. Have a good day.
You too.
That's the other one of ours. What?
What is your name?
Marge Sullivan.
And where are you from?
Here.
Here, you live here in the hospital?
No, Sutter Creek.
And what you came here to the information fair to get a little bit more information on what?
Oh yeah, on everything.
Do you have diabetes?
Yes.
And what do you do to take care of it?
I try to take care of it as best I can.
Good for you.
Don't eat any cookies.
Every now and then it's okay.
Yeah. That's something.
You eat a lot of sugar-free stuff?
I tend to not eat sugar-free. I don't like the little things. I got off of those because they only make you want more sugar.
Sure. Where are you from originally?
Originally, New York.
I can hear that. I'm from Flushing.
You are?
Born and raised.
Really?
We should go out.
Oh, sure. I came from Queens.
I'm from Queens. Where in Queens are you from?
South Ozone Park.
South Ozone Park. My dad lives in Howard Beach.
Oh, yeah. My sister did.
How long you lived here?
Since 1949.
And you still have an accent?
It stays with you, doesn't it?
It does. It does stay with
Sure
you.
it does.
It does stay with you. So here we are at the information fair, everybody. Hope you got a little bit more information on diabetes and what to do about it and how to cure it and how to, not how to cure it, but how to alleviate some of the symptoms and feel better overall. Ladies, say goodbye. Bye. We'll see you again, everybody.